I'd like to introduce and personally thank the elected official that we have with us this evening, Greene County Commissioner Paul Berkey. Thank you for joining us. And we are also joined tonight by the Town of Greenville Public Relations Manager, Amy Rose. Is there any other elected official I might have missed? We'd like to thank the Capitol Theater. This is Indivisible Greene County's third town hall event here. We're so appreciative of how the Capitol Theater has been a long-time supporter of community involvement. But it must be noted that any opinions expressed or statements made during this forum are those of the individuals attending and do not necessarily reflect the official policy or position of the Capitol Theater or any other agency, organization, employer, or company associated with them. Thanks to the Indivisible Greene County leadership team, Clem Allison, Beth Foster, Gigi and Art Gillen, Lena Kendrick Dean, Amy Saxenmeyer, and Aaron Hensley Schultz. And a special thanks to Indivisible's senior regional organizer for the states of Tennessee and Kentucky, Afton Bain, who's here with us tonight. Yay, Afton. For those of you who aren't familiar with Indivisible Greene County, Tennessee, a little bit of history. In a true grassroots fashion, we came to be about 3 years ago when two separate online groups of citizens of various political persuasions, but all concerned for our future, chose to take their social media discussions a step further and began meeting in person. The resulting face-to-face conversations on all sorts of issues had one common thread: the disappearance of accountability. So, when, very coincidentally, 3 or 4 different people showed up to one of those meetings, each with a copy of a document they had found online, the Indivisible Guide, a document with the theme of holding our elected officials accountable, we knew we were on to something. Our story is strikingly similar to those of hundreds of groups across the country that bubbled up in nearly the exact same way, a true national grassroots movement made up of local citizen groups. And one very important point about Indivisible: each local group has total autonomy to decide what national Indivisible programs and projects it supports, as well as to identify and pursue their own local issues. Which is why we've been involved with projects ranging from increasing voter participation, which reminds me there's voter registration forms in the lobby for anyone who's not registered to vote, please do so. Projects like voter registration, as well as projects like fighting for a warning system over here at US Nitrogen because of accidental emissions. Some of our earliest literature included our motto: everyday people making a difference together. So, on that note, let's continue making a difference together with this healthcare forum. A word about the structure of the evening. Whereas our event 11 months ago, Shining a Light on Ballad Health, spoke mostly to how we got here, tonight's event, How to Make Our Healthcare Work, has an emphasis on where do we go from here. So, we have to educate us on those possibilities the following distinguished speakers: Danny Cook, Dr. Ken Smith, Dr. Marty Olson, Mr. Gary Frady. Our first speaker is a disabled veteran, coach, author, web journalist, and advocate. Through her Free Hugs and Love project in Charlotte, North Carolina, focusing on the homeless, and her election efforts in Atlanta, Georgia, and the commentary she shares on her podcast and streaming Facebook Live posts, Danny Cook has committed to using her voice for the people, especially defending the right of every American citizen to have access to affordable, quality health care. Her granddaughter, Bella, was born prematurely at Holston Valley Medical Center in Kingsport 2.5 years ago and spent her first 91 days in their neonatal intensive care unit, or NICU. Ballad Health's closing of that NICU and the downgrading of 2 of the region's trauma centers compelled Danny to return home to the Tri-Cities to do all in her power to help protect the health care of her region. Her unparalleled dedication to this cause has been proven again and again, including trips to Nashville and Washington, D.C. on our behalf, and especially proven when she headed up a 24/7 peaceful protest out in front of Holston Valley Medical Center for 257 days. It is my pleasure and my honor to introduce Danny Cook.
How y'all doing? A little cold, right? I said if I'd have known this, we'd have brought our propane tanks and some tarps. we know how to handle this kind of weather. So, yeah, according to some, and a grill, but we never had a grill. So you all have some packets that were handed out to you, and I'm going to come back later and actually speak more about some of the solutions. This is to tell you why we're here. There are some things that have been said about our efforts, and there are some things that have been said about what we would like to achieve that just simply aren't true. And, you know, despite the slogan, "It's your story, we're listening," the fact that I have to come up here and tell you why we're here tells you that someone's not listening. Because we very clearly stated what our objective is. Never once have we said we want ballot health to fail. We have never once said we want it picked apart and just devastated. I think as the largest employer in our region and the fourth largest employer in the state, that is a scary prospect to everyone. So what we did ask for was transparency, accountability, and good stewardship, prudent planning and execution that allows this nonprofit to be stable financially while also being for the benefit and the well-being of the people. So you have a couple pieces of paper in front of you, and this one is just very succinctly going to tell you a little bit about how we got here and what we're going to be doing tonight. So Ballot Health exists now because Mountain States Health Alliance and Wellmont Health System merged into one healthcare system under a Certificate of Public Advantage, or COPA, in January 2018. That's when it was granted. So contrary to what some people think, nobody bought Mountain States, nobody bought Wellmont. This was a merger that took place. The COPA is a contract between Ballot Health and the Tennessee Department of Health and the Attorney General to ensure that the benefits of Ballot Health existing as a medical monopoly outweigh any disadvantages to the public as a result of this loss of competition. Oversight. The state is required to actively oversee Ballot Health to ensure that it keeps its commitments to the people. Last year, Ballot Health was unable to provide the data necessary for the state to score the COPA as required, indicating a challenge in properly executing the oversight and regulation of Ballot. So now we're seeking solutions. As the state has encountered challenges in exercising its oversight and enforcement of the spirit of the COPA, if not its legal requirements, the people have begun to voice concerns and look for additional solutions that do not limit the ability of Ballot to operate in a financially prudent manner and protects the health and well-being of the people. So tonight, one of the solutions we're going to talk about is a hospital authority or a similar governing body that replaces the Ballot Health Board of Directors. And it's a reasonable, we believe, reasonable and fair solution to this gap in accountability. The COPA outlines the makeup of the board and may be modified to allow for such a governing body by the state and Ballot Health. The myths that you may have heard, because I've heard them. I've heard these myths spouted by elected officials and government officials on local levels, on social media, and in the press. And so I'd like to take this opportunity to address them just straight on, if that's okay with you. I think that's the way we do it around here. We just address it head on. So the first thing that we've been accused of is communism. That we are proposing to seize the assets, in this case hospitals, of a private company, Ballot Health, through amending existing legislation. That is not true. What we are doing, let me just be clear, while the Fifth Amendment of the United States Constitution allows for the seizure of private property for public use with just compensation to its owner via the takings clause, we're not advocating for the state of Tennessee to exercise this option unless, of course, it deemed it necessary for the health and well-being of the population. Number two, we've been accused of socialism. Amending the current hospital authority legislation to allow the creation of an authority across municipal and county boundaries in rural communities to meet the population requirements is a move towards socialized health care. That's what they've said. Not true. Giving rural communities the same protections and possibilities for the healthcare system as urban populations have. It provides equity to often neglected people. You all know there's a running joke, right? Once you go east of Knoxville, we cease to exist. Tennessee stops. I don't believe that Northeast Tennessee should be neglected. I don't think that we should be counted out simply because we don't have one city with a 200,000 person population. So amending this legislation, or at least examining the opportunity to do so, is equitable. It is not socialism. The third rumor is in reference to your taxpayer dollars. You may have heard that we are attempting to turn Ballad Health hospitals into publicly owned hospitals, requiring the municipalities and counties to pay millions of your tax dollars to buy them. Nope. Again, not what we are trying to do. We're not talking about public ownership. We're talking about public accountability. And there's a difference. The proposed governing body would not impact Ballad Health's ownership of its hospitals. It would simply replace the current board of directors. Therefore, no tax dollars would be required. And 4, the COPA. The Certificate of Public Advantage, it's been stated, does not include a provision for the restructuring of the board of directors and as such cannot be modified through these means. You will see in the third sheet that's attached, there's a section 4.04, and this came directly from the terms of certification of the COPA online. It's the board governance of the new health system, and as you can see, it outlines the structure for the board of directors. Well, the executed COPA states that it can be modified at any time if the state were to determine that the benefits no longer outweigh any disadvantage to the loss of competition. So I would submit to you that the board of directors is covered in the COPA, and it does have the ability to be modified. So all of those things that people are telling you from a place of, this is anti-capitalism, this is anti-free enterprise, no, it is not. It is absolutely not. I am for free enterprise. I am for capitalism. I am also not for monopolies that are unregulated. I am not for a healthcare system where you've got to travel an hour and some odd away to make sure that your family gets safe, reliable care. Whether you're a provider or whether you're a patient, it's not acceptable. So I wanted to take a minute to address that so that we were clear going into this evening what you could expect from us, where I'm basing this information from, and that we're not just, I promise you, we didn't sit outside for 257 days because we just have some wild hair and some wild idea. There's a real solution that we're looking for. And I believe that the people of this region deserve it. Thank you.
Our next speaker, Dr. Ken Smith, received his medical degree from Emory University in Atlanta and completed his residency at Emory in 1989. At that time, he joined Drs. James Nichols and Antonio Valdez Rodriguez at Kingsport Neurological Associates. He is board certified in neurological surgery and is a member of the American Association of Neurological Surgeons. His special interests include frameless stereotactic surgery, cerebrovascular disease, head injury, and treatment of chronic pain disorders. A native of Birmingham, Alabama, Smith practices at Blue Ridge Neuroscience Center PC in Kingsport, Tennessee, and is a participating provider for the Spine Health Foundation, Inc. In 2016, he received the Hope Award for excellence in accomplishing the mission of the Spine Health Foundation and recognition as an individual who has selflessly provided his time to help others get their lives back. Dr. Ken Smith.
On the way over, I was thinking exactly how I was going to frame this, and I think accountability is probably the best way to start. To be accountable, you have to be accountable for something. And when I came, a health system took care of people. You entered into the facility to be healed, and you left hopefully better. And 2018, that paradigm changed. No one told us it was going to change, especially me. But that paradigm is now, you enter the facility to be moved out as quickly as possible. So from the Hippocratic Oath to the best advised model of healthcare, we've come. And nobody asked for it. We didn't see it. We had a lot of people say, what happened? And I point to that. It is simply a change in what the people 6 weeks or so, the hospital, my hospital, Holston Valley, became unable to deliver constantly just the basics of my field, which is neurosurgery. We ran out of drills. Literally, there are 8 in the hospital, and we can't find them because they're downstairs. There's no one there to clean them because the people have quit. The people who take care of my patients after they leave the operating theater have left. Why? Because they're not paid well, and they feel that they're treated poorly. All these are my opinions, and these are my opinions that come from talking with people all day, every day, and a half for 30 years. So what do we do with this particular problem? And I think the first thing we do is realize how severe it is. I think everyone who is sitting in this cold room realizes how severe it is. Everyone who feels that they've been disenfranchised and no one is listening to them, you're absolutely correct. When I talk about problems, I get an answer that doesn't address my problem. So the people that we expect to wake up and have an epiphany one day are simply not going to do so. So at this point, we have got to take some form of action as a group to ensure that our health care remains. And lastly, as a private practicing physician, I am the only private neurosurgeon in Kingsport now. And the COPA says that I'm supposed to be worked with in a good faith fashion to ensure quality and continuity of health care. The number of times I've been spoken to by the administration other than to be chided for something over the past 6 months is 0. And I found out about 2 months ago by a piece of paper from a man I've never heard of that my working relationship with my 2 partners who are hired by Ballad Health Systems has been severed. And no one talked with me, no one asked, no one was concerned about the continuity of care, no one was concerned about our inability to cooperate anymore. So these are the kind of people that we're dealing with, and this is the kind of thought process that informs them. So we're dealing with a type of impression of human beings and their treatment that we shouldn't tolerate. And the only way that we can stop that is to stand up and say, this is enough, we're not doing this anymore. And we want something back that restores our dignity in our hospital system. Thank you.
I'm looking for somebody specific. Yes, I'd like to recognize 2 doctors who have joined us this evening that I didn't even realize were here. Dr. Robert Berry, an independent physician from here in Greenville, who kindly spoke at our event back last April. And Dr. Kimmy Zook is here as well from the Department of Health. Yes, thank you so much for coming. From the Department of Health. And on the Greene County Health Board, if I am correct. Our next speaker, Dr. Marty Olson, has practiced obstetrics and gynecology in Johnson City, Tennessee for 28 years. His concern about the area's opioid epidemic led him to head a program that fights newborn drug withdrawal by helping pregnant women reduce their medication doses. His strong interest in the health of the region was a key issue in his 2018 candidacy for the U.S. House of Representatives. He has participated in public health improvement around the world, including 15 trips to Iraq to teach physicians there. My honor to introduce Dr. Marty Olson.
Well, thank you much, Jim, and I'd like to acknowledge Greenville, Tennessee for taking a leadership role in making sure we have the finest health care that we can have. So thank you, Greenville. And there's another group that I think feels underappreciated, and we need to recognize that if one of us gets sick tonight, we'll go to a hospital and there'll be a Ballad employee taking care of us. And I know some of the Ballad employees I know feel unappreciated. So I think we should give a round of applause for the In the Trenches Ballad employees. So I was here a couple of, I guess 11 months ago, and I told y'all a story about, it was an old story. But the thing about old stories is that sometimes they still go on. And so my time as a leader in healthcare is more than 10 years old. But there's this thing called culture, and sometimes you can change names, and sometimes you can change people. But if you don't change culture, you just keep getting what you already got. So that story, some of you remember, was when I worked for a hospital on a committee to design a new hospital, and I showed up with some ideas, and I learned that, no, you're just here to rubber stamp what the administration's already said to do. And I didn't want to do that, so I said, no, wait a minute here. And pretty soon the administration called my boss and said, tell Marty to shut up. So I left the committee, and they did their thing, and I just wasn't a part of the process anymore. Then I had a chance to go to the COPA hearing that was just a couple of months ago. There's a board that's supposed to report to the state, and I had a chance to speak there, and I pointed out that, in my opinion, that the people in our region are losing confidence that the decisions are being made in the patient's interest and the benefit of the public health. But for me, it was more important to hear, because I heard some stories that were very, very moving. People stood up and talked about their family members. I remember one woman in particular just went through step by step watching her family member die. And she believed that that result might have been different in a different hospital system. And I don't know if she was right or not, but I know that she believed that. I know that I was moved. But I also know that healthcare in America is struggling, that healthcare systems are composed of human beings, that doctors make mistakes and nurses make mistakes, and yes, hospital administrators make mistakes. So what I don't know is, is Ballad out here somewhere and the rest of the world's out here? I don't know that, but I do know that there's a lot of passion. So we need to keep our passion. We also need to be fair. We need to ask for things that are achievable. So let's be fair as we criticize. Now, some of the rules for the road for me are that I have an employer. At no point should anybody think I speak for my employer. I'm not even going to tell you who my employer is, but I'll admit it's a medical school located in East Tennessee. And when I was a healthcare leader, I was a part of that particular system. And it was a long time ago, and I'm going to tell you another story here in a bit, but again, I think the culture story is the same. But at no point am I criticizing any valid human being. What I'm criticizing is a system. I believe we need a system where there's accountability, where decisions are made in the interest of the public, and the public has somebody they can go to and say, listen, I'm concerned about your decisions, so I'm here about accountability. And in the state of Tennessee, we should recognize there's at least one hospital authority in Chattanooga, and that happens across state lines. I mean, the precedent is set. We're just asking for what the folks have in Chattanooga. That's really all we're asking for. So my next story involves another interaction with the then Mountain States healthcare system. And in my division, I was a leader, and we were going to provide this service to Mountain States. And in return, they were going to give us money, which we were going to use for education, and we were going to use that to improve patient care. So we're providing the service. And the check just never arrived. So, hey, when's the check coming in? Because we've got bills we got to pay. We got these educational goals we want to achieve. Still no check. So finally I went to my boss, and I said, listen, we have an agreement. They're not fulfilling their agreement. We're giving this free service. There needs to be a consequence. And my boss says, oh, you better talk to the university president about that. So, all right, go talk to the university president. We're giving away this free service. They've agreed to fund it. We're not getting paid. We need to say, listen, if we're going to be partners, you got to keep your agreements. Well, as far as I could tell, the university president was with me, so I sent the administration a note that says, 1 month from now, we stop this service. You've got this month to find somebody else to do it. But we can't afford to give away free service, and you promised to pay us, and you're not. Well, that prompted the hospital administration to send an email to the president of the university saying, get rid of him. Now, Fortunately for me, I was a tenured professor, so I couldn't be fired. I could only be humiliated and demoted and have my salary cut. And now I have a chance to take care of patients. I don't have to see hospital administrators every day. Life is good. But the point is what I learned from this. What I learned was we had at that time, and again, I can't say that's how it is today because I'm not a hospital leader or a physician leader anymore. And I'm sure I never will be again. And there's advantages to that. But the point, what I learned was that there were thousands of people working for Mountain States at that time. And they all had one job, their most important job. Make sure you never upset the CEO. That was their job. Now, if they gave some good patient care, well, that'd be good too. But their job was never upset the CEO. And there's a good country term for this. That term is bass-ackwards. Because should the administration's primary job be take care of the employees? Administration, take care of the employees so the employees can take care of the patients. That's how it's supposed to work. And that's not how it was working then. But it was even worse than that because I didn't work for them. So anybody that had a contract with them, rules were the same. Make sure the CEO is happy. Anybody that sold them anything, make sure the CEO is happy. Anybody that took advertising dollars, make sure the CEO is happy. So it's not just the system that's affected. It's everybody that touches the system if you have a situation which is run as a dictatorship. And I'm not saying that's how it is now, but I am saying that there's no safeguard to make sure it's not happening tomorrow. There is no safeguard. If tomorrow the board says, you know what, why don't we sell this and give some golden parachutes out? I'm not aware of any way that we the people could stop that. So this speech is about why we need to have some system. Maybe we're going to restructure the board so there's community involvement. Maybe we're going to have a hospital authority. But there has to be some system in place for accountability. It's too bad it's not Certificate of Public Accountability. I wish they called it that because that's what it should have been. But no, it's advantage. Now, some of this sounds a little negative here, so I'd like to finish on a positive note because let's talk about what we want. And what you may not realize is that this COPA for the Valley Healthcare System happens to be the largest COPA in the United States. Biggest in the U.S. Well, that means to me that maybe we should be the best then. Maybe our vision should be finest healthcare in rural America right here. And to get that, we're going to have to demand it. And to demand it, we're going to have a voice. And to have a voice, we have to have people on the board. So let's go forth with a goal. Best healthcare in rural America, and let's have it right here. Thank you.
Thank you, Dr. Olson. As most of you know, this system is so big, it officially affects 21 counties in East Tennessee and Southwest Virginia, but 29 counties when you throw in the Kentucky counties and the North Carolina counties where people travel to these hospitals as well. So every county needs a voice. And we're going to need representation from as many counties as possible in coming up with whatever system is coming up with to have public accountability. So, on that note, our next speaker is from Hawkins County. He's been a resident of Hawkins County for 44 years. Gary Frady is a graduate of University of Tennessee, where he received a Bachelor of Science degree in Business Administration. He worked in industry as a human resources manager for 40 years, a Navy veteran with 4 years active duty. Mr. Gary Frady.
Thank you. I appreciate the opportunity to speak with you. I come to you from a little different perspective than you've heard tonight. You have providers, professionals that have given you a perspective. Now I just give you a grassroots perspective. Let me start off and give you some information you've already heard, but there's a reason behind it. Again, my name is Gary Frady. I'm a retired human resources manager. I'm a Navy veteran. My wife and I have been married for 51 years. We have 3 married daughters, and we are the proud grandparents of 4 remarkable grandchildren. I tell you all of this so you can have a reference point from which to judge the sincerity and validity of my comments when I tell you that I have no personal agenda, I'm not seeking any office, and I'm not being paid by, nor do I work for, any political party or any outside organization that may share any of the concerns that have been or will be addressed during this meeting tonight. I can also tell you that I'm a charter member of the Rally for the Valley Citizens Advocacy Group in Kingsport. I'm one of the so-called fools that spent 257 days camped outside Holston Valley Hospital where we protested the changes Ballot Health has imposed upon our citizens. My passion for joining the fight for a say in the health care decisions for our region stems from the fact that my youngest granddaughter was born prematurely and required specialized neonatal intensive care. She was born at 28 weeks. Her eyes were still fused shut, and her lungs were barely developed enough to sustain life. The top-notch doctors and neonatal intensive care nurses at Holston Valley Hospital worked tirelessly for 3 long months to give my granddaughter the gift of life. And thanks be to God, they were successful. My granddaughter is now 13 years old as of today. She's a typical teenager testing the limits of parental authority and seeing just how far her grandparents will run interference for her with mom and dad. Sadly, however, I must tell you that our Rally for the Valley group failed to stop Ballot Health from closing the Level 3 NICU at Holston Valley. Likewise, our efforts to stop the downgrading of the Level 1 Trauma Center at Holston Valley were unsuccessful. In addition, we were unable to stop the closing of the Cancer Infusion Center at Allendale in Kingsport, and to prevent the merging of Wellmont and Mountain State's assets under the Ballot Health umbrella. So you might ask, why do we continue to fight against the politicians, the corporate power mongers, and the state and local backroom good old boys who are seemingly unstoppable? In reply, I simply say, if it is not I who fights the battle, then who will it be? And if it's not now that I fight the battle, then when will it be? I'm here tonight to speak out against the state-sponsored monopoly which is systematically dismantling our healthcare delivery systems in favor of building a healthcare mecca in Johnson City. As citizens, we are asked to ignore the fact that Johnson City is not the geographical center of the Ballard service area, and to accept increased transport times to get emergency care as the new norm. We are asked to trust Ballard as the all-knowing authority as to what is best for us, as if we are too uneducated or too uninformed to make sound healthcare decisions for ourselves. Ballard Health has systematically lessened and restricted our healthcare choices. They have dramatically increased the prices we must pay to get care, and they have put in place such add-ons as facility fees to further increase the cost of obtaining services. They have limited our access to appropriate health care services. And while paying lip service to quality of care, Ballard has allowed emergency room waiting times to soar and staffing levels to plunge to perilous levels. All of this is just the tip of the iceberg with respect to the actions of Ballot Health's coercive monopoly. Now, you may ask, just what is a coercive monopoly, and how does that affect me? Well, Webster's Dictionary defines 4 areas that describe monopolistic practices. Area number 1, exclusive control of a commodity or service in a given market. In Kingsport, one cannot travel one of the main streets of the city without being assaulted by Ballot Health signage seemingly over every billboard or Ballot-owned building. Area number 2, control that makes possible the fixing of prices. While I do not have evidence of any price fixing by Ballot, I can tell you definitively that prices for services have soared, in some instances 4 or 5 times higher than those charged by HMG, which is another independent competitor, if you will, in Kingsport. Area number 3, exclusive control granted by a government. Ballot exists as a monopoly only because our state legislators changed the law to allow for it. Area number 4, coercion. This means to constrain or restrain by force, threat, or intimidation. I would ask you to ask any current or former Ballot employee or provider if they understand the meaning of this word. We are all here tonight because our state elected legislators unilaterally took it upon themselves to literally change the existing state law and to intentionally and purposefully create a monopoly. When I say they changed the state law, I mean they changed selected portions of the Hospital Cooperation Act of 1993 so that competition could be eliminated or reduced to such levels that a monopoly could control a majority of a given service area. This change in language made it possible to create a state-sponsored monopoly in Tennessee under the guise of a Certificate of Public Advantage, or COPA. This legal end run allowed Tennessee, and by extension Ballot Health, to avoid the oversight of the Federal Trade Commission with regard to federal antitrust violations. The Tennessee Department of Health and the Tennessee Attorney General were given the responsibility to guard the public's interests against monopolistic practices due to the elimination of competition. I believe by any measure you choose, these parties have failed miserably in their oversight duties and have not protected the public interest. What we do know is that the offices of both the Tennessee Department of Health and the Tennessee Attorney General have failed to adequately monitor the actions of Ballot Health by turning a blind eye to obvious violations of the COPA agreement, by failure to adequately investigate public complaints against Ballot Health's monopolistic practices, by retroactively approving Ballot actions that were supposed to be approved prior to their implementation, by failing to independently verify data supplied by Ballot as to accuracy and correct application, and in general, acting as nothing more than a rubber stamp for Ballot's monopolistic actions. Just this past year, the Tennessee Department of Health and the Attorney General admitted that they were unable to measure whether or not the COPA agreement had produced clear and convincing evidence that the advantages of the COPA outweighed the disadvantages to the public welfare. This past summer, Deputy Attorney General Janet Kleinfelder stated in an FTC workshop that the state may not be able to score Ballot Health's performance under the COPA agreement for another 5 years. This clearly is a violation of the COPA agreement, which requires an annual score to be determined and publicly reported. Yet everything continues on as if none of this matters, when in effect this amounts to gross oversight negligence on the part of the Tennessee Department of Health and the Attorney General. Numerous reported instances of conflict of interest on the part of some of our state legislators and on the part of leading figures within the Tennessee Department of Health go uninvestigated and ignored. The complaints of ordinary citizens are summarily dismissed or are assigned to the graveyard of benign neglect. So what can you do as a citizen? Number one, you can get off the couch and get involved with a citizens advocacy group. Stand up and speak out about your concerns for your health care and your hospitals. Number two, you can vote. Forget parties and vote for people who will work for you. Number three, not only should you vote, but you should check the voting records of incumbents on issues important to you. Hold them accountable for their votes by withholding your vote from them if they are not performing the job you elected them to do. Number four, as a community, get behind the effort to establish a hospital authority or a hospital governing body that gives you a voice in how health care is delivered to your county. Number five, call, write, email, text, visit, or otherwise engage your county mayor, your county commissioners, your state representatives, the Tennessee Department of Health, the State Attorney General's office, and the Governor's office, and express your displeasure over the lack of oversight of the ballot health monopoly. These are all things that we as concerned citizens can and should do to help ourselves. In closing, I want to say that the absolute worst thing that any of us can do tonight is to walk away from this meeting as apathetic bystanders. To walk away with the attitude of let someone else do the heavy lifting rather than getting in the arena and getting dirty ourselves. That's the kind of thinking that got us into this healthcare mess in the first place. And exactly the kind of thinking that power-hungry politicians, backroom good old boys, and monopolistic predators like Ballot Health are counting on. They depend on your silence to continue their coercive and monopolistic practices. We, the people, must let our collective voices be heard loud and clear, or our healthcare system will continue its downward spiral. Finally, to rephrase an earlier comment that I made, I pose this question to you, the audience, tonight regarding our fight. If not you, then who? And if not now, then when? I thank you for letting me speak to you.
Slight change in plans, not in your agenda. A few minutes ago, we were given permission to read an email from Ballot Health that we weren't sure we could do so, but we've got the permission, so I will give you some snippets of that. It was their email declining the invitation to attend tonight from Mr. Tony Keck. After talking about some back and forth about setting up meetings, blah, blah, he says, "More disappointing is that Indivisible Greene County has chosen to host this event with Rally for the Valley, a group who, as we discussed previously, has demonstrated little interest in constructive dialogue or examination of facts. We therefore have no option but to decline to attend." Lending Indivisible Greene County's voice to the notion that state law permits the seizure of assets of a private not-for-profit hospital system does a disservice to Greene County residents. No municipality or government body has such authority, and contrary to what you may have been told, the COPA does not include a provision for restructuring of the Ballot Health Board of Directors. As Ballot Health remains a private, not-for-profit entity, Those claiming that such options exist or that can be gained through legislative action are only seeking to draw attention to themselves by misleading the public. The Metropolitan Hospital Authority Act, available online and a link, applies only to hospitals owned by a municipality such as a city or county. There is no statute that allows a city or a county to seize a hospital from private ownership and place it under municipal governments with or without compensation. Should a local hospital authority be formed in Greene County, assuming the legislature would consider modifying the minimum population required, and local government would then agree to create the authority, said authority would not have a hospital to govern and operate. Should it decide to do so, it would need to raise the funds through tens of millions of dollars, bold-face type, tens of millions of dollars of new local taxes on Greene County residents, to either build a new hospital or purchase a hospital in the county. It would then require additional taxes to subsidize any losses that this newly acquired hospital may incur. As we discussed in our meeting, from 2014 to 2018, Greenville East and Greenville West lost, we're talking Tacoma and Laughlin, lost nearly $38 million, losses that are today subsidized by Ballad Health, not Greene County taxpayers. On top of subsidizing operations, Ballad Health has invested more than $21 million in capital improvements to Greene County hospitals. Ballad Health remains committed to the health of Greene County residents, and we are proud that we have been able to preserve access to quality services within the county while hospitals throughout rural America shut their doors. For example, we are actively working with a community visioning committee to plan our future local investments in behavioral health and addiction recovery services for women who are pregnant or homeless. Local physicians and community health leaders provide continuous input and guidance into our decisions and will continue to do so as we work not to just improve the health care we deliver, but the health of the community. I'm sorry you do not feel that working together is an option for your group, but we understand your organization may have other priorities. Art and I did reply to that email, a brief reply, in which we asked, in lieu of your attendance, would you let us read the statement? And we finally heard at 6:20 tonight that we could. I'm sure someone would like to respond. Although she actually has in some of her earlier comments, because she'd heard, or we have heard, these types of arguments in other venues, at the Kingsport Board of Mayor and Aldermen, for instance. Anyway, Ms. Danny Cook again.
Well, hell. It's very rare that I'm left speechless, as you all know. I typically find words fairly easily. So do you understand when I say they are not listening? You literally not listening. No one said take your hospitals. No one said seize your assets. No one said make taxpayers pay millions of dollars. And here's what I heard. I heard we wrote this COPA in such a way that legally we don't have to do this with you, so we're not. That's what I heard. I heard I don't care that almost 30,000 signatures signed, 30,000 citizens signed their signatures to a petition saying we don't agree with what's happening here. We want you all to slow down on the changes that you're making in our healthcare system. We want some transparency. We want some accountability. We want some public advantage. They don't care. And then they'll criticize me because I say they don't care. What did you just hear? Did you hear they care? No. You know, let me do this before I go on a rant. Y'all know I can do that, right? Before I do that, contrary to what some people believe, I listen to my heart a lot. about what I'm supposed to be doing and how I'm supposed to be doing it. And so I didn't write my statement until 3:45 today. No, 3:15. Don't judge me, Jim. 3:15. And I'm one of those people that I just kind of go, okay, God, tell me what I need to say. So just bear with me for a minute, and is it okay if I share with you? Okay. How many of you guys know that I'm a poet, that I write? So like when I was in Charlotte, I used to perform poetry all the time and be on the radio. And in the poetry community, whenever you get up and you perform a poem, it's called spitting. I'm not going to spit on you, I promise. It's just a phrase that we use, that you spit the poem. And in the poetry community, we have a saying, 3 or 3,000. And what that means is that regardless of the number of the people in the audience or watching, you spit that poem with the same passion, the same intensity, and the same purpose. I carry that motto with me in every area of my life, and I trust that who is meant to be here will be here, who is meant to watch will watch, and who is meant to take action will do so. I was born and raised in Bristol, Tennessee in the early 1970s. My mother and father settled here after he was medically discharged from the Army after 2 tours in Vietnam as a captain and a physician's assistant. It's quite an accomplishment for an African-American man back then. They'd met in nursing school at Walter Reed Army Hospital and married in 1963. And after leaving the military, they bought a home in Bristol to raise their 2 boys while hoping for a girl. I was born several years later. My father died 6 months after I was born. I went to elementary school at Holston View and Fairmount Elementary Schools. Miss Shutters, you're still my favorite. Miss Carter, thank you for the stories about my dad. And Mr. Terry Caudell inspired my love for drawing. I attended Lee Street Baptist Church, sang in the choir, called Reverend Johnson Rev, went to Vacation Bible School, and I ate at the Corner Dog House every Saturday while at choir rehearsal. All my Bristol people watching are like, yeah, the Corner Dog House. Now I don't even want to know what was in the hot dogs or the chili, but I promise they are amazing. I left at 18 when I joined the Army. And although my highest scores were in the medical field, I chose communications because of the lesser time commitment. After serving my country for 5 years, I moved back home where I got married and raised a family for another decade before moving away again. Now, some of you may be asking, what does this have to do with how we can make our health care work? Good question, because to me it doesn't. But because there's been this constant narrative in the media that I'm not from here, I don't truly care about the people here, or that I'm only doing this for attention, I thought it appropriate to share with you who I am and why I'm truly here. Keeping it real with you, I never thought I'd come back here. Growing up as a biracial child in Northeast Tennessee in the early 1970s was not very fun. Being too dark for most white people and too light for most black people made for a pretty lonely experience much of the time. Add to that gifted education classes and a solid vocabulary, because my mom would kick my butt if I did not enunciate and pronounce my words. It gets even more challenging to find where you fit. Looking back, though, I realized that it was all preparing me for this moment. I can be here, and I can speak to just about anyone in a manner that they can hear me. Not just hear me, but hear me. I can and have listened to many of you and your experiences with our healthcare over the last 15 months, and I hear you. Oftentimes, I feel you. And truthfully, I am so sorry I have not been able to do more. In the beginning of this journey, I believed that if we simply showed the people overseeing this COPA what was happening, how it impacted us, that they would do something to help us. My optimism made me believe in the hope that regional and national attention to what's happening in the lives of patients, nurses, EMS workers, and physicians as a result of this merger and the COPA, that someone would step up and fix this. That hasn't exactly worked out the way I'd hoped. But what has happened is incredible. I have met people from different faiths, different political parties, different tax brackets, and different just about everything else you can imagine. And we've been able to put aside all of those differences and focus on this one thing: having access to safe, quality health care. I met people that I now consider to be my brothers and sisters who have stood with me in the blistering sun, pouring rain, and extremely cold nights for 257 days outside Holston Valley Medical Center because they believe the people of this region deserve a healthcare system and politicians they can trust to do the best thing for them. We've walked the streets and ran to cars collecting almost 30,000 signatures from local residents and then traveled to Washington, D.C. together for the FTC workshop on COPAs, and we hand-delivered those signatures to our members of Congress. Some of you, Phil Rowe, betrayed our trust with those signatures, but I digress. That wasn't written down, I just threw that in. Just saying. We've been the subject of social media and news attacks. We've stood in a courtroom defending our constitutional rights from an attempt to silence us by government officials and local business leaders. 2 weeks ago, we walked the streets of this city, knocking on your doors, handing out flyers, and inviting you to join us. Why? Why, for over 15 months, have these folks sacrificed so much of their lives? Do you truly believe that it's for attention? Really? Do you believe it's because we don't have anything else better to do? Do you really believe that George Soros and Black Lives Matter are paying me? That's literally been put in print on social media because people want to tarnish your view of me. They did the same thing to Indivisible Greene County to try to keep people from coming because people disagree with some of their stances with regard to sanctuary cities and guns and whatever else. None of those things are what we are talking about right now. And none of those things matter at the end of the day. Every single one of us has to come together, despite all of our differences, to move this forward. They are not going to do it unless we make them. Do you think it's for any of those reasons, or do you think that for me, it could possibly be that on August 11th, 2017, I had no idea if I was going to lose my granddaughter and my daughter due to an unexpected early delivery at just 26 weeks. And because of the incredible, absolutely phenomenal staff at Holston Valley Medical Center's NICU, because of them, I have them both. And I owe them everything. To my nurses, in my efforts to shine a light on the things that have changed. If I caused you harm, know that I'm sorry. That was not my intention. In the process of giving them my everything, thank you. Not planned either. I looked really cute at first. In the process of giving them my everything, I learned about laws that had been passed, bills of secrecy that limit the rights of the people, and plans to downgrade and discontinue services that the people of this region deserve to have. So it became about more than just the NICU for me. As phenomenal as they are, and as grateful as I am to Dr. Powers, to Dr. Tanvir, to Dr. Martin, to Heather, to Suzanne, to Shannon, to all of them, it has now become about more than just them. It became about why my parents sacrificed themselves to serve this country. It became about why my daddy left this world at the age of 33 as a result of that sacrifice. It became about what is just simply the right thing to do. So I am still here. We are still here. And it's why we're asking you to join us. Join us in asking for public accountability from a nonprofit public benefit corporation who exists because they made a contract. They made commitments to the state of Tennessee and to the Commonwealth of Virginia. And against the advice of all the experts, the states agreed. 46 healthcare economists submitted a letter to the state of Tennessee, to the Department of Health, along with the FTC, and said, do not grant this COPA. They said it's going to decrease your quality, it's going to increase your prices, you're not going to be able to enforce it. Do you want to know why this was so important to them? One of the people is Lemore Daphne. She's from Harvard. She testified before Congress in February 2018. And she stated that by the year 2020, one in every every dollars in the United States would be from healthcare. Did you know that? One in every $5. It's a pretty lucrative industry, wouldn't you say? And there's a difference between a nonprofit being financially prudent and flourishing financially like a for-profit. And I think that those are things that need to be addressed. I promise I'm going to stop sniffling at some point. Besides the fact that it's cold, and then I started crying, and now it's just horrible. Promise me you took pictures before I started. Okay. So listen, let me explain to you how this works. The current hospital authority legislation says, yes, you have to have a municipality that has 200,000 population. But there's also language in that hospital authority that talks about co-creating municipalities and co-creating geographical areas. So one of the possible ways to do this and to just kind of step out forward is one county can actually pass a resolution. And what you can do with this resolution is you can say that you would like to begin to hold public hearings to explore the possibility of a hospital authority, and you can include in that resolution that if at some point the state determines that we don't meet those guidelines, right, that you're not kind of violating it intentionally and we can rework it. I need for you all to understand that when this first started, there was no legislation that allowed ballot health to exist, not as it currently does. So what did they do? They changed it. And I'm sorry, but if our politicians can change the law for special interests and corporate healthcare companies, they can change it for the people, right? And if they can't, we can vote them out of office. David Hawk, shame on you for not being here. Shame on you for not being at the local COPA Advisory Council again. Notice I said again. Like I've been to like 3. I haven't even seen him in person yet. Just saying. Right? So there are ways. This is my thought process. And it's not just me when I say my thought process. I promise you there are really smart people talking to me. I know that frustrates some of y'all that are watching. Yay, that makes me happy. Just a little bit of joy, but okay, so that's one thing, the resolution from a county level or a municipality level. The other thing is that you can talk to your state legislators about setting up a committee to explore the amendment of the existing Hospital Authority Act. And what you would want is a committee that would look at in rural communities like ours, where you don't have one big city that has 200,000 population, but if you could combine them, you would reach that, right? So you have Sullivan County that has 157,000 residents. You have Kingsport that has 50-something thousand. You have Hawkins County that has 50-something thousand. How many's in Greenville? 68,000, right? So Why does rural Northeast Tennessee and rural America really get left out because we've got more land than skyscrapers, right? Rural lives still matter. So if nothing else, right, because we know that the session is in session. The session is in session. Y'all know what I mean. We understand, but they should be at least willing to put together a committee that explores the establishment of co-creating municipalities. And why are we excluding counties, by the way? The state of Tennessee doesn't even recognize municipalities. It recognizes counties. So why doesn't this legislation include that? And we believe that it should. We believe that it should give us the same governing ability as Chattanooga has. So like, for example, you know, if we wanted to get rid of our CEO like Erlanger did, just throwing that out there as an example. I'm not saying that we do. I'm just, you know, giving you an option. But another way to do this, and this was my hope, again, I'm forever the optimist. Y'all know me. I try to be all love and happy. Is I keep saying, or similar governing body. Ballot Health has said a number of times in the media that we need to move forward, that they want to build bridges in the community, that they want to, you know, establish relationships and communicate. They've got I'm honest on billboards, and I care on billboards and on your Facebook ads and your TV ads. So my thought process was, all right, listen, we gave you your 4-foot strip of grass back, not because we had to, but because we chose to. So let's come to the table. If I can get over you trying to make me a felon over dead grass, then you should be able to get over me telling people what's happening in the hospital systems. That's honestly the way I feel. Did you all know that they tried to make me a felon over dead grass? Yeah, it was lots of fun. Not really. Not really. Not really at all. But it's not about me. If it were about me, I would have packed up and moved back where my other friends are and gone on about my business. And some days I think about it. But it is truly not about me. I believe this is where I'm supposed to be until God tells me different. And I believe that the people here are worth it. There's a heart in this community that has been downtrodden for a really long time by big industries and healthcare systems. And people have had to put up with it because they provide your livelihood. And that's not fair. It's not fair to hold people hostage because you employ them. And so you can kind of dictate how much money they can make and where they have to go get treated when they get sick. It's not okay. It's not what I strapped on boots and Kevlar for, you know? So this is my question to those of you guys in the audience. Well, before I get to the question, screw this, vote this piece right here. I'm not very politically correct all the time. I think I'm doing really good though. Like I've kept it PG-13. I'm doing great. Here's my question for everybody that's in this room. Are you willing to actually become active in this effort? Like when it's time for your county commission meetings, are you going to show up? Are you going to send emails to your state legislators and to your congressmen? Are you going to send letters to the editor, to your media folks? Not when you just want to, but on some days when you're tired or when you have other stuff to do and when it's going on. We can all find reasons to not be doing this. And they'd be good reasons. I got gorgeous grandbabies I could be keeping and, you know, a really good-looking dude I'd like to see. It's a sidebar. But really, this is your community. Look at Tacoma and Laughlin and ask how they got here. and ask, why does the state of Tennessee want you to believe that Tacoma's not a repurposed hospital when they repurposed a hospital? And the COPA actually says that a repurposed hospital must maintain everything in Exhibit E. Do you want to know what the number one thing on Exhibit E is? An emergency room. Does Tacoma have an emergency room? Not anymore. The Tennessee Department of Health actually tried to tell me that Tacoma was not a repurposed hospital. I said, well, what the hell do you call it? Because you literally say in the COPA, you're repurposing it. We're not idiots. Country, not stupid. How many of you all, when we leave this event tonight, can we count on to get involved? You don't have to come, like we're not outside anymore. You don't got to do that. But in your community, in your area, I'm not asking you, to do everything that we do. But how many of you all are going to take it upon yourself and stand up for what you deserve to have in your community so that your babies and your mamas and your husbands and your wives and your children have access to safe quality health care? So we don't have to listen to physicians say, I don't have the equipment to do surgery because it's downstairs and nobody's cleaned it. I don't know about y'all, but that's flabbergasting to me. And yet, somebody's going to tell you, I promise you, somebody's going to put out a statement to say that's not true. I don't know about y'all, but I know who I believe. So I'm going to ask you, I'm going to kind of put you on the spot by a show of hands. How many of you guys are ready to step up and be part of the solution? That's an awesome sight. Ask me questions. Ask any of these individuals questions. I get a lot of messages. I can't respond to everybody, but I am here to help educate, to send you documents. I'll tell you where you can find the information. A lot of it is in the Citizens Advocacy Group. We are here to help. We can't do it by ourselves. It's going to take every single community and county that we have. But regardless of what they try to tell you, this is the American way. This is what patriotism is saying, nope, this is not okay. People deserve better. Are there any, before we go into the rest of it, because I have a statement to read from another physician, does anybody have any questions specific for me? And I know I'm out of order, but I'm just like, anybody? I kind of fly by the seat of my pants. Y'all get that by now, right? And I don't even have my glasses on. Do I see a hand? I thought I did. Yes. Yes. It doesn't, actually. Let me share with you why. So Ballard was pretty smart. They learned from Mission's mistakes over in North Carolina. So have you seen yesterday in the news where the Attorney General for the state of North Carolina wants answers because HCA bought Mission Healthcare? Mission used to have a COPA, and then the state of North Carolina revoked that COPA. They ended it. And then HCA came in and bought them. And the Attorney General tried to do his best, like they tried to put some of those COPA commitments into the purchase agreement. But the trouble is being able to enforce it. That's something that the FTC said from the beginning, is it's really hard to enforce the commitments. So what Ballard had was they had a survivorship put into the terms of certification. So right now, if they were to get rid of the COPA law, Ballard would still get to exist, and their COPA would still exist for that 10 years. Now, the scary part about this is that they have a COPA for 10 years, but they are going to be a medical monopoly forever. So after 10 years, it is up to Ballard whether or not they enter into another COPA agreement with the state of Tennessee. And if they don't, they become a legal medical monopoly with no oversight, no accountability, and even less than what we have now. So One of the things that can be put on the ballot, though, is the hospital authority or the governing body. That is something that we could absolutely put on the ballot. So the difference with this is that we would want a governing body that's actually elected by the people. It would be defined. And so I'm going to give out some examples. None of this is written in stone, but this is just through brainstorming. So you would want it to include medical professionals, right? And you would want those medical professionals to be people who were already retired, but who had like tons of experience, but their practice had been over with for at least 12 months. Senator Gardenhire introduced legislation similar to that for Erlanger to alleviate any conflicts of interest. So one of the conflicts of interest right now is we have David Mays on the board of directors. Well, he's an anesthesiologist, and his anesthesiology company provides anesthesiology for 3 of Ballard's hospitals, I believe. And on one of their 990s, that he was paid his company was paid like $2.8 million. I just don't buy that he can be an impartial voting member of the board of directors when he's making $3 million. Okay, so this is the difference. First, the local COPA Advisory Council isn't for enforcement. Only the Attorney General's office and the Tennessee Department of Health are for oversight. The local COPA Advisory Council is supposed to hold the annual public hearing to be able to get public comment and feedback as to Ballard's performance from the public. And then their other function is to help disseminate public health funds, population health funds when they become available, because there's none in that pot right now. So they actually don't do oversight. This governing body wouldn't be a committee. This body would replace the board of directors. So all of the power that the current board of directors has, this governing body would have. So hiring and firing, oversight of contracts, inspections, reviews, all of those types of things. They would see the books, they would see the finances. Everything that the current board of directors has, this body would have. So it wouldn't be a committee. It would literally be a body elected by the people, and kind of collaborated together with this vision that they would now have public accountability and would replace the board that exists right now that has a lot of conflicting relationships in it. Does that help explain? Mm-hmm. Right. Well, and so there's nobody's going to be able to say, well, this definitively can or can't happen, right? But here's what we do know is it would be better than what we have right now. And at least it's a start. So I could look at this and say, well, what's to keep this from happening and what's to keep that from happening? I could look for all the reasons that it, potentially might not work. But to be quite frank, I don't have the energy for that. I have to look at plausible solutions and things that might occur that would give protections to physicians, to nurses, to EMS workers, and to patients. And this is the best option that we have. So legally, you can't go, well, you can. If you have $6 to $66 million, you can walk into court and you can challenge the COPA because they put it into law that you have to be able to put up a surety bond, an appeal bond in order to challenge the COPA law, right? So I don't know about you, but I don't have $6 million laying around. I don't have that. So this is what we have to look at is what are some realistic things that we can do? I know physicians and I know retired nurses and I know retired EMS and healthcare workers that would make excellent board members. Excellent board members. Do I think you still have to have some business, administration type people in there? Of course. But right now the plan of separation isn't even executable because Bart Hove left the day that they issued the COPA. So that made Alan the president and the CEO. Those two things don't go together. So this is a step towards something better. Do I have any guarantees? No. Who does? but I know that this is something moving in the right direction. Dr. Berry. I agree. You can't trust the politicians. So that is something that we would absolutely. So this is the point. Remember when I said that one of the counties could simply pass a resolution to start holding public hearings? That would be what we would be doing. We would be holding these public hearings to determine how people would be elected, how people would be selected, and what do those things require. So like the current board of directors, I think 3 of them have to come from Southwest Virginia. There has to be a total of 11 of them. The way that my brain thinks about this, and this is just off the cuff because I'm nobody's expert, but when I think about this, I think, okay, Greene County, you have a large geographic region like spaced out. You have 2 of the hospitals. Okay, so Greene County gets at least 1, maybe 2 of those positions, right? You got Sullivan County, same thing. You need 2 from there, 1 from Washington County. You can combine counties somewhere around like Johnson and Unicoi. This is just me off the top of my head. But this is the purpose of public hearings so that you can come out. We can have these conversations and say, well, how do you think this ought to work? I personally think EMS ought to be represented. I think nurses ought to be represented. I think physicians ought to be represented. I just believe that that's part of it. And then I do believe that there has to be some sort of accountability and reporting. Another thing that we need to be doing is having SB 2048. That law sucks. So if you all don't know what SB 2048 is, that is the bill that Gary Hicks brought up. It was HB 2020 then, and then Rusty Crowe put it forward. And what it did was it allowed Ballard to hide pretty much everything that the COPA requires them to turn over to the state of Tennessee unless they want to give it to you. That's why you don't ever know what's going to happen to your hospitals until it's already happened or it's going to happen in like 60 days. And you're like, really? I didn't know you were going to close the NICU, or I didn't know you were going to close this, or I didn't know, I went to Indian Path and there's no longer cardiology. Because that law allows them to keep changes, downgrades, and eliminations of your services private from you. I just don't think that that's something that happens. It also allows them to keep complaints secret. Complaints should not be proprietary information. How can you judge their performance if you don't know the complaints? Going back to what's happening in North Carolina, do you know how many complaints it took for the Attorney General in North Carolina to take action? 30. We have almost 30,000 signatures, and our Attorney General's like, yeah, we can't even grade it for like 5 more years. What? What is happening in the state of Tennessee? It's not acceptable. Question. Well, hold on, because we do have some other questions that I want to get to before we get into just commentary. So if there's no other specific comments, just questions just for me, Dr. Berry. God, I would love to know. So county commissioners in Greene County, your folks would like to know when you're going to have a public hearing. Like, that's what you ought to be asking your county commissioners. Before I go any further, I do want to read so that my Southwest Virginia folks know that you are not left out. Although we intend to do this throughout the region, we started in Greene County because you've experienced, just like Sullivan County, a lot of the major changes, right? And so I reached out to Dr. Starla Kaiser. She could not be here. She had a prior engagement 2 hours away, but she did give me a statement. This statement is her opinion, and I'm going to read it to you before we move into the rest of the Q&A portion, okay? I am so thankful for your continued efforts to fight for the needs and interests of our citizens in Northeast Tennessee and Southwest Virginia. Thank you for never giving up. Thank you for persisting. I am a physician in Southwest Virginia and started a clinic to help those without insurance before Medicaid expansion in 2017. As an independent provider, I would refer patients to the local health system for care and heard story after story of patients seemingly paying higher costs for less accessible care. I saw patients being funneled to hospitals as lower cost options in the community were closed. I saw suspect billing practices and low-income patients being sued. I saw the effects of consolidation as routine care was referred to larger hospitals in more urban areas, and patients in our rural communities were left with expensive transfers and delays. I saw small healthcare businesses suffering at the expense of this monopoly and doctors and nurses leaving our area. I was incensed that this healthcare merger appeared to be yet another example of a large corporation taking advantage of our region, and this time, lives were at stake. Since I ran for office a few short months ago, I have continued to see how our health system appears to be failing our patients. I have read in the New York Times about Ballad suing over 6,000 people last year. I've seen 2 of Ballad's flagship hospitals receive 1-star quality ratings by Centers for Medicaid and Medicare. I have seen Ballad become the sole owner of a Virginia community hospital so that decisions now can be made unilaterally. I have witnessed the issues faced by all of you peacefully protesting. Still, despite this negative national media attention, the health system apparently has continued full steam ahead on its path of taking over hospitals, consolidating services, shutting down facilities, influencing state and local legislators, and pressuring employers and local governments. Like you, I believe that the health of a region's people cannot be at the whim of a corporate entity whose primary motivation is money. As Ballad continues to take over nearly every aspect of care in our region, how do we ensure that there is strong oversight and a counterbalance to the profit-driven desires of this monopoly? The health of our region, like our federal and state governments, needs a system of checks and balances. We cannot simply rely on hospital executives and board members, especially those with financial interests and vendor relationships with our health system, to make decisions that are truly in the best interest of our people. Some of the most difficult issues that desperately need to be addressed in our region are also those that do not get the highest insurance reimbursement and those that bring the health system the least amount of money. Many of these issues facing our citizens in Northeast Tennessee and Southwest Virginia, like addressing our mental health crisis and curtailing opioid addiction, will cost us money. These issues should be the focus of every policymaker, hospital executive, and board member. Yet, even though addressing these regional issues were stipulated in the COPA, what I have seen are actions that appear to pass the buck and deprioritize these low-margin issues, despite the fact that consolidation and thereby the reduction of staff and services has saved this health system millions of dollars. As an example, creating a behavioral health department at an academic institution is not the same thing as hiring qualified mental health professionals and treating more patients to improve access to behavioral health services. Repurposing a hospital to become an acute rehab facility that accepts Medicare dollars is not the same thing as repurposing the hospital for substance use and mental health treatment, even though our region is in such desperate need. Overall, concerted efforts to improve our region's population health should be undertaken wholeheartedly by this health system, now our only option, and not outsourced to NGOs and other community agencies and foundations. Taking over the medical care in our communities comes with the responsibility of treating our most fundamental and pressing needs. We need an entity that can see through the smoke screens and determine the true effects of this merger in our region. As we work to ensure an independent entity is providing adequate oversight, we must ensure that our public and population health needs, as outlined in the COPA, are also being addressed. I agree with the efforts to establish a hospital authority to protect the public health of our citizens. A hospital authority can also help with oversight of our healthcare merger. In Virginia, despite the fact that the merger had been in effect for well over a year, an oversight committee was established only a few months ago. Yet, even the oversight committee is not free of conflicts of interest. Oversight cannot be effective and accountability cannot occur as long as these committees are not truly independent. We cannot naively rely on a presentation of cherry-picked statistics by a Ballad employee every quarter and be comforted that this merger is working. We need independent boots on the ground to help us track short-term outcome data like readmissions and mortality, hospital-acquired infection, and complication rates. We need to study those patients in our rural communities who were transferred and had possible delays in care due to consolidation. We need to audit patient bills to determine discrepancies in Ballad's billing practices. We need to look at accessibility metrics, patient satisfaction surveys, and even how this health system's actions are affecting our local economies. I am thankful that the FTC will be studying this COPA and help provide these answers. A hospital authority will also provide additional needed oversight to ensure that accessibility and quality of care is not suffering since the merger. Yes, this may sound like a lot that needs to be accomplished, but adequate oversight does not need to cost millions of dollars. It's about putting the right people in place with expertise, independence, and a passion for the health and well-being of our community. Thank you again to every single one of you who have taken the lead and who continue to persevere and fight for our region. I believe that all of your efforts, all the seeds you have planted, the pressure you've exerted, the tireless and agonizing work, the numerous prayers, the sleepless nights, they are making a difference. So do not grow weary. Your efforts are not in vain. So many lives have already been touched and so many people have already been inspired, including me. We now have an opportunity to continue to bring this region together and bridge the gap between this healthcare system, our providers, and our citizens. I remain fully supportive of your amazing efforts. Thank you. That was Dr. Starla Kaiser. All right, so I'm going to turn this back over to Jim, and then we're going to get into any more Q&A that we might have. I have some questions that were submitted online that I'm going to pull up, and then we're going to continue to talk through this. I know that it's chilly and cold. I appreciate all of you for sticking here and for being engaged and for wanting to help find a solution. So thank you. I'll take that one. I think it's practical to do all the above, right? Your county commissioners got to live here. Like a lot of them go to your churches, they go to your schools, they got to be here every day. One of the reasons they don't feel like they have to be here is because when they have their meetings, not enough citizens are coming there and in their face. You know, that's part of the reason is that they don't feel like they got to show up. If you're not coming and you're not standing before them and saying, hey, this is an issue that we care about, this is an issue that matters to us, then they're not going to show, right? So it's a two-way street. You to the county commissioner that's here is, she's from the area where we see issues having happened where they had a COPA and they got rid of the COPA law and they were purchased by an outside entity. And so you basically have a, for-profit monopoly system in Mission Health. And a lot of people in this area are considering going other places, or how long are they willing to be here if these things can get straightened out. So the idea is, are you willing to go back and have those conversations, or are you and other county commissioners willing to meet with other residents, not necessarily talking about pushing things forward, but just informative meetings where you're not violating sunshine laws and things of that nature is what she's asking. So I don't want to get into too many of those things. There's such a thing as EMTALA, which is like emergency medical treatment. So if someone's dying, you can't be turned away, not supposed to be. I don't know about Mission, so I'm not going to speak to that, or ballot. I'm just saying I know that those are experiences that are had. So that's the question that she's asking. So I'll give the county commissioner an opportunity to respond to her question. Jim, you have the other mic.
Well, thanks. I came here mostly to find out some stuff and learn, because everybody is saying everything, and the information I hear is very convoluted. It's going all over the place, and so I'm willing to gather information from all sources, including this one. I do know that that other commissioners, and including myself, are aware. Our constituents are coming to us and saying, "Hey, this stuff is going on," and we are. The sense is that we feel a little bit of helplessness now. I've heard what you described. I've never heard those words before. That you processes that you talked about this evening, and so yeah, I would say those conversations are going on, but it's sort of what is our power to succeed as something like this.
So, and I get that. If I could speak to that, where we are at right now, quite frankly, is where Mountain States and Walmart were in 2014. They didn't have existing legislation. There was no clear path forward on how to make this happen. And they had meetings and they got the public behind them and they made websites and, they held forums. They did all of those things. And so those are the things that we need to be doing. So that we can get other people informed and other people educated. Like I said, there's been a lot of misinformation about our intentions. Public accountability, not public ownership, is the goal of this. And so I think it's a realistic thing to say, how do we do this together? So I am very grateful for you coming and hearing information, and feel free to reach out if there's any other question I can answer, or any other information. I'm happy to send you the statute as it currently stands, the committee ideas that we outlined, and as well as you already have the governing body information that's already in the terms of certification. I do think that if each of the counties were to submit a letter to the Tennessee Department of Health asking that this part of the COPA be modified, I do think that would carry weight. I really do. So that's something else to consider.
Can I say that this is the point of this evening, first steps. And we really do appreciate you being here, Commissioner Berkey, and we really do appreciate you hearing. And it is us as thank you. It is us as Greene County citizens' jobs to be at the commission making statements about where we stand and what we feel so that they even know. He's obviously hearing from constituents privately. We need for them to be hearing from constituents publicly, although at commission meetings they're a little tired of indivisible, because we're some of the only people that speak on a monthly basis. We need to be doing our part to convince our commissioners they need to be acting at and there even is action that can be taken. So thank you for coming to be educated. Now it feels like, even though this is first steps, we're way late because the COPA is 2 years old. 2 years old at the end of January. And I don't know if you knew about this, but in the rural hospitals, after 2 years, if I'm incorrect, correct me, Ballot Health can fire employees without cause. We've passed that 2-year mark.
They have to give notice before they do that, and there's a certain number that they can't exceed within a certain window. But after 2 years, the commitments to rural hospitals change. And in case you don't know, other than Suffolk County, Washington County, and Johnson Memorial, everything else is considered rural.
So things aren't going to get better real soon until something gets done. And Dana, thank you for your input. These are the kind of stories that we've been hearing at the protest. I'm sure you were hearing it constantly in front of Holston Valley by people volunteering their stories. When I was collecting petitions at the Iris Festival, people had stories after stories after stories. I heard very few good things. When we were canvassing 2 weeks ago to spread the word, and thank you to the people who did that from both Kingsport and from Greenville, every door, no one turned us away. As soon as they heard we weren't on Ballard's side, they needed to talk. So, yes. Welcome. I'm sorry.
So, Dr. Ken Smith is gonna respond to your statement.
Yeah, thanks for asking the question. That's the toxic environment that a monopoly permeates. You don't get the extra people coming in. It makes it difficult to recruit. Nobody wants to lay down roots and spend time like they did in the older model. And that's why I said there's been a shift right under our feet, and you got caught right in the middle of it. But that is one of the effects, and that's a good story that needs to be told to people who support that sort of thing in the monopoly.
So, I'll share this with you. That would make an amazing letter to the editor.
Yep.
that would also make a compelling letter to your county commissioners, to your state representatives, to your congressmen, and to the Tennessee Department of Health. One of the things that they have said is it's not going to prevent people from coming here, and we have maintained that it will. Yeah, young families, like they talk about us being, you know, a retirement area, and we know that, right? That is very ridiculous.
Yeah.
Okay, so I was going to say, you will want to call your insurance company. You will want to ask for a bill and make sure that you do get it itemized, because if you don't ask, you will not get it itemized. You will want to make sure that you do that yourself. You may even want to talk to your insurance company about a separate complaint. And if you were told that you can go anywhere that takes Medicaid or Medicare, then you may want to call CMS. Are both of you guys on social media or no? Are you on Facebook or anything? Okay, so Citizens Advocacy Ballot Health is a Facebook group. It's not affiliated with Ballot. I created the group. And in that group, under announcements, is a list of organizations to contact with all of the phone numbers, the email addresses, and all of that. But don't wait for them to file it, because if you wait for them to file it, you may end up having a summons to court before you get a bill. Yes, ma'am.
Yeah. Yeah, welcome. Sorry.
So, okay, so we could talk about some of the other.
That's okay.
So I'll talk with you afterwards. We can talk about other areas, other options for you as well. But yes.
It's really just a statement. I'm Amy Rose. I'm the PR manager for the town of Greenville. I'm not an elected official, but like Commissioner Berkey, I'm here to learn. And I've got to sneak out a little early to get to my family. I apologize for that. But I wanted to let you know that I just happen to be the person that you contact if you want to get on the agenda to speak to our Board of Mayor and Aldermen. So feel free to contact me, okay?
Thank you, Amy. Really appreciate you being here.
Yeah. Good stuff. So I want to make sure that we use the physicians that we have as well. So if anybody has questions that they can answer or that I can answer or anybody else, feel free to ask them now, because this is a time where, you know, we really want to kind of get nuts and bolts, like, what do y'all want to do? And can we do this? I believe that we can do this. I really do. And I will say this. I think that they think we can do it, which is why they're not here. I really do, right? Because if you were interested, this is a time to engage in productive dialogue, right? So.
I have a question back here from Clem.
Yes.
Mr. Frady, your statement was very clear and very concise and very informative. Do you have a copy which could be distributed?
I have what I have right here. You want to make a copy of it?
Good. Great. Okay.
Yeah. We'll, if we can get them electronically, we'll take every speech that was made tonight and make them available. Wolf.
Since I don't understand the medical industry, all that, but
with all the stuff people do with insurance, where's the insurance industry figuring dealing with ballot? How's that connection? I mean, they got a lot of muscle everywhere.
So I'd say that's a United States problem. That's not a Northeast Tennessee, Southwest Virginia problem. So it's part of the milieu of what ballot has to deal with as they try to create solutions. I mean, I could just tell you story after story after story of patients being compromised by our insurance industry. But let's be fair, that's not ballot's fault. That's outside their area of things that they can fix.
If you look real carefully at the COPA, what they're doing is they're shifting that over to your pocket. So the insurance companies probably are value neutral here because they got prices frozen probably for a significant amount of time. So to them, they probably see that the quality's going down, but the prices are frozen, and hence these fees, et cetera. Actual cost goes up to the patient, but the visible price the insurance company pays stays the same. So they really don't have a pony in this right now until the quality gets to be an issue.
But if you're a patient that you're not happy with your care, contacting your insurance company is a thing you can do. And the insurance company is going to be interested in that. They're going to be very interested in, I'm not happy with the care I got, and you paid the money. So again, in terms of what you've heard about contacting folks, that is another group you can contact.
Right, that's very important. Any pressure on ballot coming from any direction is a help. So when you are asking for that itemized bill, it is just as important to be telling your insurance company how unhappy you are with ballot.
Right. The other thing, too, is to remember that about 70% of the patients that go to ballot are on, like, Medicare, Medicaid, or TRICARE, right? So the reimbursement levels are kind of either at or a little bit below cost, so that the strong arm muscle, like Cigna, Aetna, United Healthcare, it's a smaller portion of ballot's patient market, so it doesn't have like necessarily the same impact. And they do have some frozen rates and things that Dr. Smith was alluding to written into the COPA. So that's why complaining to, or not complaining, but filing complaints, making sure that you articulate to your insurance companies what your experiences are is incredibly important. You can also talk to, you can file it at the Tennessee Department of Insurance and Commerce. They are also interested in what's happening from an insurance perspective as well. If your insurance was dropped, like I know certain plans are not accepted at some hospitals that were Legacy Wellmont, but they're accepted at hospitals that were Legacy Misha. Those are also things that they're interested in and that need to be addressed as well. Anything else? So before we wrap up, several of these can't be answered. Like, for example, this one is for David Hawk. I'm going to read it anyway, just in case he hears, which I'm sure he will. But here it is. It says, this is a two-part question. One, this is for Representative David Hawk. Please describe in detail your thought process of why it was necessary for you to sell out Greene County constituents to help close Tacoma Hospital, it's an insult to call it Ballad, reduce Laughlin's to a patch them up and ship them out hospital, and displaced many healthcare workers. Number two, several years ago, I served on the COPEC, Committee on Pediatric Emergency Care, which I find interesting. I printed out that report. And it says, I served on the Disaster Committee to help develop protocol and procedures for the state of Tennessee. With the threat of the coronavirus on the horizon, how prepared are all of Ballad's hospitals to handle a pandemic outbreak? If you have protocols, procedures, and guidelines on how to execute an emergency plan, please make that plan available to the public, especially for very rural communities. As a small reminder, I was only talking about pediatric, which has the highest mortality rate, along with the elderly. However, what full-scale plan does Ballad have in place and ready to activate if needed to control the spread of a pandemic outbreak? Very relevant question. This is another question that was submitted online, and it says, why does Ballad have a different, and remember, they declined to be here, but people didn't know that at the time. So why does Ballad have different contracts with insurance carriers that are different between each facility or medical practice they own? I have examples of being charged the equivalent of a 5-year supply of medicine to see my PCP, which is owned by Ballad, versus the same pills being received in the hospital. It's a question that needs to be answered. Second question, why does Ballad not contract with ER physicians that are in health networks? These incur additional cost to individuals who have insurance but aren't saving or receiving excessive bills. I'm sure that Marty and Ken would agree. This is an issue that they do all across the country that is not good for the people. We know that healthcare as a system for the country is broken. Ours is like broken and on crutches and wheelchairs and life support, but as a whole, it's broken. And so one of the things that they do is they contract with these ER physicians groups that are outside of network, so you get a separate bill from them. I think it is fair to say that if you're going to be a medical monopoly, that you ought to be able to contract with individuals that take the insurance of the people that are here, since they have no other choice but to go to yours. So anything else you guys want to add to that? Nope. This one, I don't know that we're going to get an answer to, but it says, I have a question as to why is Ballad allowed to classify itself as a nonprofit, yet when insurance companies pay, they're willing to sue someone when they are receiving extensive tax breaks for their equipment and materials? A lot. I would presume, just because you see them everywhere. In addition to that, they have a PR firm in the state of Tennessee that they contract with, and then they hired Ballard Partners, B-A-L-L-A-R-D Partners, back in the summer, which is a huge lobbying firm from Florida to do their lobbying efforts in D.C. So, you know, I personally think that money could be better spent in its community, but who am I? Any other questions out here? Just making sure that I got the other ones that were from online. Oh, wait. Oh, this one we already addressed, about how the hospital forum would be run. This is a question for the state reps and senators and people that are already in office or running. People are wanting to know, are you willing to expand Medicaid? And I do want to address that, because some people have said, why haven't we made this about Medicare for all? And the reason is Medicare for all doesn't change whether we have a medical monopoly. So that's an argument for a whole different arena. It has nothing to do with our objective here. So I just want to make sure that we stay on topic of what really applies for us and the people of the region. So if you guys, do you have any other questions that these guys can answer or that I can answer before we wrap it up for the evening? Okay. Well, let me tell you this. What I will tell you is I have a really good friend of mine whose cardiologist works for Ballad. And when he needed a procedure done, his Ballad cardiologist advised him to go to Vanderbilt. I'm just sharing information, because you asked where should you go. I can't tell you where to go. I can just share with you where my friend went. Yeah, Knoxville. Yes, Knoxville would be the closest. Yes, because they're not really equipped for that. So Knoxville would be the closest fully equipped that's not valid. Yes, ma'am. Anything else? Just for feedback purposes, did you all hear information tonight that was new or that was informative or that, has given you some direction about some things that we can do? Yes? No? Yes? Yes? Good. Please tell your neighbors that. Tell your neighbors that. Tell the folks at church and in your schools. Let's really band together. That's what it's going to take as a region to make this thing happen, okay? I appreciate all of you all for coming out. I'm going to turn it over to Jim.
And I have a question as well. What kind of county representation do we have here in the room? How many from Greene County? Okay. And now how many from Sullivan County? Okay. Do we have any Hawkins County? Yay. What am I missing? Washington County. So we're almost halfway there for the state. Okay. Go home and tell your neighbors about it. And if you're not following Danny Cook, following Citizens Advocacy - Ballot Health on Facebook, it is incredibly helpful. She does a Facebook Live every Monday through Thursday, 8 o'clock.
Sometimes I'm a little late, but 8 p.m. I'll do that.
Really, really helpful. Vote, as we said, voter registration forms. Talk to your commissioners. Talk to your aldermen. Run for office.
Yeah.
I mean it. I'm serious. Yes. Yep. Okay. Okay, real quick so that you can get out into the warmth. Thanks again to our speakers. We really, really appreciate this, both this time and last time. Thanks to Commissioner Berkey. Thanks to Amy Rose. Thanks to Afton for coming and for always supporting. We appreciate you. Thanks to the Indivisible volunteers who helped with this evening. Thanks to the Indivisible volunteers, the Greenville Rally for the Valley Volunteers, and the Kingsport Rally for the Valley Volunteers that all went knocking door to door here 2 weeks ago. Oh, I did want to say that was an amazing afternoon. So we may be looking into organizing more of that to spread the word about this county, about this hospital authority or of similar governing body situation. So I'll be looking to Indivisible Lights to be hitting the streets again for that. Please hit Indivisible Greene County's donation jar out front so that we can continue to do events like this and other community efforts. Thanks to the video guy. We have an email list. I guess you all signed in, hopefully gave us your email. The newsletter from Indivisible Greene County, Tennessee is an amazing document. We have a lot. We always have a ballot update. And Indivisible's next meeting, Sunday, the 8th of March, at the Tabernacle Soup Kitchen and Garden, 715 Wesley Avenue, Greenville. If you're in town, if you're a Greenvillian, come. 4 o'clock on Sunday, March 8th. And big thanks to the Capitol Theater once again for hosting us here. There's a couple things coming up at the Capitol that you, if you're in Greenville, you may want to do. Tomorrow night, you can enjoy the comedy stylings of two of Indivisible's very own. From our leadership team, Erin Hensley Schultz and her husband Steve Schultz are part of an improv group called Blue Plate Special, which will be here tomorrow night at 7 o'clock. Perhaps the funniest $5 you ever spent. And if you're a fan of yacht rock music, this Saturday night here on this stage, Smooth Sailor at 8 o'clock. Most importantly, thank you to you for coming into the cold, coming out of the cold, something like that, coming out in the cold. Thanks to you for joining us. Hope this was informative. Hope it was a bit inspiring. Please get home safely, everyone, and good night.
And thanks, Jim.
Oh. My pleasure.